the Childhood Begins at Home Budget Advocacy webinar. My name is Becky Ludwig. I am the Vice President of Public Policy at Pennsylvania Partnerships for Children, or PPC for short. I will be joined today by PPC's Government Affairs Directors, Katie Brilhart and Justin Fleming, who you'll hear from shortly. So just a quick note at the top is to please keep your microphones muted as this webinar is being recorded. If you have any questions throughout our discussion today, we encourage you to write your questions or comments in the chat box, which we'll be monitoring throughout. And both this recording and the slides will be shared with participants and available broadly to others who are not able to join the live discussion. So before we get into the core message today on budget advocacy, we wanted to provide some background about our campaign and current data. Childhood Begins at Home started in 2017 and brought together evidence-based home visiting models operating in Pennsylvania, along with advocacy organizations who support policies benefiting families with young children. The campaign primarily focuses on educating state policymakers, both within the legislature and the administration, about the many benefits of evidence-based home visiting on children, pregnant women, and families. These outcomes include improving health, safety, literacy, and family self-sufficiency. And then we also advocate for increased state investments to reach more individuals who could benefit. Here's a snapshot of the organizations who sit around our governing table. We now have 6 evidence-based models who receive state funds. Those are Early Head Start, Family Checkup, Healthy Families America, Nurse Family Partnership, Parents as Teachers, and Safe Care Augmented. The non-model advocacy organizations alongside PPC include Allies for Children, Fight Crime, Invest in Kids, and Trying Together. And additionally, we have several dozen endorsing organizations who are listed as key supporters. And turning now to the data, this slide is showing how we calculate unmet need, or in other words, the 95% of individuals not yet receiving evidence-based home visiting services, but who our campaign has determined could benefit the most from receiving these voluntary services. And I'll walk through our calculation. So the first point there is that 40% of all children in Pennsylvania are living in low-income families, or as we define, below 200% federal poverty level. So as you can see, that's just under 330,000. And this population number is what we use as our denominator. And then the next number there that we have is that slightly over 17,000 are currently receiving evidence-based services in Pennsylvania. And this number served as what we use as our numerator. So the key takeaway is that only 5% of those who could benefit the most are currently receiving services. This is the percentage that we use in our talking points with policymakers. And it really illustrates the need to increase investments so that we can reach more than just a fraction of families. One more note about the data. On this slide here, we are looking at the data disaggregated by race and ethnicity. This is new this year for us, so we only have 1 year of data that we're able to present. But as we move forward, we'll be able to compare the years and the trends. And just to note, this is data by the entire state. We use the same concept or method as in the previous slide. So we used a population denominator, which would be children under age 6 under that 200% FPL, and then the number served as our numerator to calculate these percentages. And just to be clear, this is not a breakdown of the 5% that are served currently by race and ethnicity. This is rather looking at each group independently and determining the percentages served within each group so that we can compare it uniformly. So as you can see, there is some disproportionality. The percentage of low-income Asian children served was only 2% compared to the percentage of children who identified as 2 or more races, which is at 5%. And that's more in line with the total statewide percentage served that we had just talked about. So again, as we get more data year over year, we'll be able to do more of an analysis. So the bottom line of all this data that I'm sharing here is for you to take away this point that only a fraction of children and their families are currently being served by evidence-based home visiting services in the state. So with that backdrop of why we need more money, I'll turn it over to Justin Fleming to move us into the budget advocacy portion of our discussion.
Thank you, Becky. Good afternoon, everybody. Thank you for joining us today. So as Becky noted, the Childhood Begins at Home campaign was constituted in 2017 as a way to increase investments in evidence-based home visiting services. So the amount of state dollars that are used to support evidence-based home visiting services. And the constitution of the campaign was really modeled after what was happening nationally with the maternal, infant, and early childhood home visiting program. That's the federal line item that funds evidence-based home visiting. And so by coming together as a coalition, our mission then was to win increased state investment year over year. And I'm happy to report that in the intervening 4 years, that has happened. Prior to the pandemic, the coalition was responsible for funding wins and increases in the two lines that comprise the state spend in evidence-based home visiting. And those lines are the community-based family centers line and the nurse family partnership line. Specifically, so the total funding as it says there, we have been able to increase the total funding by about double what it was before the Childhood Begins at Home campaign began. And so that is significant, particularly when you think about the fact that on the state level, we have had no revenue increases and the fact that this is discretionary spending. In other words, yes, there is federal money that is spent here, but there is not necessarily a trigger for the Commonwealth to spend state money on evidence-based home visiting services. So this was really significant. Most of the funding wins have been gained in that community-based family centers line. But like I said, overall, since the campaign began, we've been able to increase the amount of dollars invested in the amount of dollars invested, since the start of the program. It was around 16 million prior to the campaign being constituted, and now it is the total funding is up to about $33 million that is invested in those two line items, the community-based family centers line and the nurse family partnership lines. And so we're really happy with that progress we've made. Katie's going to talk a little bit more about this year on the next slide, but just wanted to also note there that for the first time since the pandemic began, in a bill including stimulus funding, home visiting was included. So the American Rescue Plan includes $150 million for the maternal, infant, and early childhood home visiting program. And that will be allocated through from what we're hearing, through the traditional funding allocations that are usually done by HHS. And so Pennsylvania stands to receive, if our calculations are correct, anywhere between $5 and $6 million of that. And there are some allowable uses for that funding, among other things, technology upgrades, both hardware, software, and training for both home visitors and the models, as well as parents and the clients that they serve. Expenses on things like diapers, non-perishable and perishable food items in some cases. So recognizing that need still exists, we will have some additional funding to be able to support families. And so with that, I will turn it over to Katie Brillhart, who will discuss more about our funding needs and our funding ask for this year.
Thank you, Justin. So this year, Governor Tom Wolf made his budget proposal on February 2nd. And generally, what the coalition has done in the past is before the governor's budget proposal is made, we work with the administration and try to suggest, a good amount of an increase for evidence-based home visiting via our two lines. And then if the governor proposes an increase, then we can work to make sure the General Assembly sees fit to agree with that and then pass that into law. This year, unfortunately, Governor Wolf's budget proposal included no increase for evidence-based home visiting. So that has really changed our strategy. Right now, the campaign is working to advocate to the General Assembly, to members in leadership and rank and file members, just to let them know how important evidence-based home visiting is and how great our needs are. So this year, our ask is a $6.3 million increase, and this would be split between the two lines that Justin mentioned earlier. It's a $3.9 million increase for the community-based family center line, and then a $2.4 million increase for the nurse family partnership line. And as we go a little more in depth in how you can reach out to your legislator and advocate for these evidence-based home visiting programs and this increase that we talk about here, don't worry, we'll talk about some resources that you'll have to use during those meetings. But right now, I'm going to send it back to Justin to talk about some of the virtual events that the campaign has held.
Thanks, Katie. And as I mentioned earlier, beginning in 2017, the campaign had been successful in getting increases year over year for evidence-based home visiting. One of the big reasons for that is because the campaign began to launch events. Now, obviously, now in the midst of a global pandemic, these events are virtual. And I will talk about these, but I think it's important to back up and sort of see where the campaign has been. As we go through our work, when there is a new General Assembly and, it begins there, but we are always constantly reassessing the members who we should speak to and give us the best chance for success in trying to get additional funding for evidence-based home visiting services. And so that process with the coalition is constantly taking place. And we have identified key legislators to do events in their districts. Since I have been with PPC, we've done events in Washington County, Lancaster County, Delaware County, Montgomery County, Lycoming County, which is where Williamsport is. We have been to Danville, Northumberland County, and then this year we have done 2 events so far virtually, and we have a third one planned as well. And the thing to note is, we are targeting, in a lot of these places, we are targeting Republican members of the General Assembly because, Republicans have the majority in both the House and the Senate. And really, for any budgetary success, we're going to have to convince the Senate and House Republicans to invest in this spending. And so, when we go to Lycoming County, for example, we're talking to Senator Gene Yaw. When we're going to Northumberland County, we're talking to Representative Kurt Mosser, who is in the legislative leadership in the House. Bringing it back to today, these virtual events. So the legislators that we're speaking to at these events, and they're wonderful events. Oftentimes we invite the media, but it's comprised of at least 1 or 2 of the evidence-based home visiting models that operate in that county. We have a family on hand to discuss how evidence-based home visiting has helped them, including the children that are being helped. And again, these events have had, they're responsible largely for our success in getting these funding wins, because we are showing legislators the benefit, and parents are speaking to the benefits of evidence-based home visiting right with the legislators one-on-one. And we did a big event in Allegheny County as well 2 years ago, where we had a lot of members of the General Assembly attend. I think there were more than 10 or 12 members of the General Assembly just at that one event, because Allegheny County's got such a big delegation. So, and these have really paid off and helped us really get the message across to legislators that evidence-based home visiting works for families, and that it's a program that should be invested in, and for lack of a better term, gets us a lot of bang for our buck in terms of not a lot of resources, but the benefits that it provides to families. So just on March 31st, we did an event, a virtual event in Fulton County with the elected district attorney there, one of the county commissioners, as well as the models, and a couple of parents were on the line. And we had Senator Judy Ward and Representative Jesse Topper join us for those. And in Lancaster County on April 13th, we had two of the models join us, along with House Speaker Brian Cutler and Senator Scott Martin, who's now the chair of the Education Committee. So again, we've been very strategic in how we plan these. A lot of them have gotten media coverage, and even the virtual events have gotten media coverage as well. So, we have had a lot of success with these, just, bringing the point home about how helpful evidence-based home visiting services are and the benefits they provide to families. And so with that, I will send it back over to Katie, and we can talk more about this.
Thanks, Justin. So just building off of what we've recently discussed, the campaign partners that Becky told you about in one of the first slides, we have been actively meeting with our targeted lawmakers to try to urge an increased investment in the two evidence-based home visiting lines. We've been meeting with rank and file lawmakers. We've been meeting with appropriations staff. We've been meeting with chairs and folks in leadership. And what we do, it's important to get the message out and to speak to the folks that we know have a say in this process. But it's even more important for home visitors and folks like yourself to be doing meetings with your legislators in the district. So we're going to go through how you can meet with your legislator, and I'll just give you a couple tips, and Justin will jump in as well. But just to get you started. So just to let you guys know, the most impactful meetings that you can have with legislators involve the families that you work with. So keep that in mind when you're setting up your meetings. If you have a family that you're working with and they will agree to join you in a virtual visit, that's always very important. Folks like Justin and I can lobby members and can tell them stories that we've heard from our home visiting events, but it really helps to have a lawmaker's constituent, a family who's receiving services, in the meeting to explain just how helpful evidence-based home visiting has been for them. So in order to talk to your legislator, the first thing you want to do is figure out who your legislator is. So you can go into any kind of search engine and just search Find My Legislator PA, and that will take you to Pennsylvania's General Assembly website, where you can either search for lawmakers by county, or you can put in your address and find out who your House member or your senator is. And that website will also have contact information. You can reach out to a person in the district office. You can send an email directly to the legislator, and those email inboxes are monitored by staff. And someone should reach back out to you and be able to help you set up a meeting. So if you have a willing family, that's really helpful, like I said. But if you don't, don't be afraid to meet with a legislator yourself. As the home visitor, you are the subject matter expert. You have the real world experience, and legislators and their staff do want to hear from you. So to prepare for your meetings, we would suggest that you review the Childhood Begins at Home visiting fact sheets. Justin will go over those in a little bit, and we'll show you where to find them. And like I said, they have the budget ask, they have information about all the different models. And if you pull them down, the county specific versions, you can tell the legislator or staffer exactly which evidence-based home visiting model is available in your county. So it's important to prep, to read over these documents. If you're working with a family that you're that you consult with. You may want to go over what you want to talk about beforehand, just so you're all set up. We also suggest looking at the virtual platform to test it to make sure that everything's running smoothly. During the pandemic, there are some members that are willing to take in-person meetings, but for the safety of everyone involved, we're still suggesting that folks do virtual meetings. That can be over a platform like Zoom, or you can do a meeting over the phone. So just test out your meeting platform beforehand, and then don't be afraid to speak to your legislator and tell them your real life stories. Be succinct, be polite, and be flexible. And then as soon as your meeting ends, after you take some time to think about it, just send a thank you note as a follow-up. That's always very helpful, especially when you're making a budget ask. So just a couple tips that I have, and then I will send it over to Justin, who's very passionate about this, and I'm sure he has a lot more advice for you. We do use different strategies with Democratic members versus Republican members. Don't be afraid to go to whichever member is in your area. Budget advocacy is important for members on both sides of the aisle. But when we speak to Republican members, we generally talk about how home visiting, evidence-based home visiting, really helps take folks from dependency to self-sufficiency. We talk about how it gives families a hand up. And we really emphasize the fact that, like Justin mentioned, you get a lot of bang for your buck. These programs are evidence-based, they are proven to work, and they are very, very helpful for families. And, home visitors have been working throughout the pandemic. That's also a point that we like to stress. When we speak to Democrats, we talk about the same points, but we also may talk about just the family aspect, about how folks are hurting and folks are in need. And these services are really, really necessary to help families out in Pennsylvania, families who are living at under 200% of the federal poverty line, families who may have had a job loss, first-time parents, families on Medicaid, things like that. So I'll hand it back to Justin for a few more tips for you.
Yeah, and just to dovetail off that last point, Katie, I think she covered it pretty well, but regardless of party, one of the points that we make is to have legislators see this as an investment. You're paying for an investment now in these services to prevent, to have families work towards self-sufficiency and prevent, resources being allocated afterward, whether it's because of, incarceration at the far end, but also things like, persistent unemployment or the need for investments in, say, TANF or things like that. So what we're trying to do is as Katie said, with these services is help to give families a hand up rather than a handout. And I think that is a message that resonates with everybody. Just wanted to add one thing. If you have a family there, as Katie said, it is most impactful. If you don't, share your expertise, but also, yes, they like facts and figures. And as we'll show you in a second, we have fact sheets that are one pagers. They're easily digestible, but I think with programs like evidence-based home visiting, stories are what matters. So I'm just going to share one of my favorites. We were at an early childhood education caucus event, and it happened to be a nurse family partnership model nurse that was testifying at this hearing, and she mentioned she was from Schuylkill County, and she mentioned the fact that she had received services from Nurse Family Partnership, and that having that experience inspired her to continue her education, go on, become a nurse, and now she's an NFP nurse herself, and she is helping families in the exact same manner in which she was helped at one time. And so that's one of my favorite stories that we tell to legislators, and it was available there in a public forum that in which we were able to discuss evidence-based home visiting with the General Assembly. And it's just, those are the things that resonate with legislators, the stories, how families were helped, maybe they were in the Allegheny County event, we heard from, moms and dads who were just in dire straits, and how home visitors helped them get their lives back on track. You know, one of the other things that you may want to stress too, or have parents stress, and one of my takeaways from several of these events have been the relationships that are built between the home visitors and the families that last long after the services are provided. So they remain in touch. You all remain in touch with your families in some cases for years beyond just providing that services. So bonds are truly built between home visitors and the families that they serve. And so that's another thing that will resonate with legislators as well. So now we'll talk about the materials that you can use and where you can find those. So just there at the bottom, you see, if you visit childhoodbeginsathome.org, you can have access to all of our materials. In some of our other areas, we can get data on a district level for evidence-based home visiting. We have county level data. And so, you know, just be mindful of that, particularly if you're talking to a state representative or a state senator that represents multiple counties. You'll want to provide that legislator with a fact sheet from each of their counties. So especially in the state Senate, there are some senators who represent, you know, 3, 4, 5 or more counties. And so just when you set up those meetings, you just want to include materials for each their entire district, for the counties that comprise their entire districts. And so you see a model map down there at the bottom, county level fact sheet there in the middle, and then it is two-sided. So the fact sheet, the top sheet there is the front side of the fact sheet, and then you flip it over and it's got the data for each county on the back. And so, like I said, really good digestible information. And more these days, legislators are looking for data. They're looking for evidence that, especially when they have non-discretionary funding that they allocate, they are looking for information that says that the programs that we're advocating for work. And so we have that data, and we're happy to provide that. We have infographics that you can use on social media, as well as a video with all describing what evidence-based home visiting is and what all of the models do. And so we have just a treasure trove of resources there for you at childhoodbeginsathome.org.
All right, thanks.
So
Justin,
I think, yeah, sorry, kicking it back to you, Becky.
Thanks, Justin. There we go. Advancing the slide. So as we're bringing things here, winding it down, I just wanted to reiterate, if you have any questions or comments, please put them into the chat box. We'd love to hear your reactions as we're walking through, or any thoughts that you might have on what we're presenting today. So in wrapping up, here are some ways to get involved in the Childhood Begins at Home campaign. So first, if your organization has not yet signed up as a campaign supporter, we would encourage you to join us as an endorsing member. You can contact us to get your organization formally listed on our website and in our campaign materials. And then secondly, and this is, as you know, Katie and Justin just walked through in fine detail, is, you know, the most immediate item on our to-do list, or hopefully your to-do list, is to contact your local legislators and you know, request those meetings to talk about the benefits and the value of evidence-based home visiting, and to really push our budget ask for this year. And then the third item is participating in our story banking project. And this is really just, you know, almost a repeat of what we heard from Justin and Katie on, you know, sharing data is really an important part of our advocacy push, but what's sometimes equally or even more impactful is just hearing those personal stories and having those families talk directly to legislators. So in order for us to really get more of those stories, we'd love for you to help us collect them. We could get those either in written format with potentially some photos, or in a video format. So we'd really look to you all as the home visitors who are on the ground doing the work to help us with that story banking. And as we've heard from legislators, you know, putting names to these numbers really goes a long way. And then last but not least is to be sure to follow us on social media. Please like the post, retweet the post, repost them. all that good stuff when it comes to looking at both Facebook and Twitter. We have our handles there at the bottom of the slide. And for those who are really savvy on social media and active in that realm, I just wanted to plug an upcoming event that we'll be holding actually next month, the month of May, where we're going to have a Twitter chat to talk about children's health insurance. So we've been focusing on different stakeholders for several months to help us get the word out to families about, either free or low cost options for children's health insurance. And in May, we are looking to have home visitors help us with that aspect. So be on the lookout for some more information on that piece. And then on this last slide, just kind of looking ahead, we wanted to note some of the other big topics that are coming down the pike. So the RFA rebid, as well as MCV reauthorization. And this is where we'll potentially be holding some future webinars or sending pertinent information about these topics that are important to the field and to the work that we have. So with that, and thank you, Marcia, saw your comment there on the resources. With that, I'll just note, if there's any final questions or comments, go ahead, plug them in now into the chat, but I will turn it back to Justin to bring us to a close.
Thank you, Becky. Just wanted to leave you with a final thought. There's our contact information. If you have any questions at all, Katie and I have been doing this for a long time. We've met with nearly every member of the General Assembly, even the new ones. So if you have questions about your legislator, what they're like, if we've talked to them about home visiting before, please feel free to jot down our emails, reach out. We, like Becky said, we do this for a living, and we really appreciate the opportunity we have to advocate for programs such as this, and for the betterment of kids and families. And so we are privileged to be able to do this work on your behalf, and just want to encourage you to reach out to us if you have any questions at all, or if there are any ways in which we can be helpful to you as you advocate for this year. Just want to, it's going to be tough. It's going to be tough. Traditionally, the governor sort of sets the pace with a proposal, and then we usually follow that, but with no increase proposed, we have our work cut out for us. So just wanted to remind you of that, and again, encourage you to ask any questions you have, and feel free to contact us.
All right, thanks, Justin. That concludes our webinar. Thank you all for joining us. Have a great day.